Hi, everyone. Welcome to the Rhode Island State House for Go Local Live. I'm Go Local News editor Kate Nagel. Thanks for joining in this Thursday afternoon. I would like to welcome a special guest, Kerry LaPlante from the University of Rhode Island. Kerry, thank you for joining us today.
Thank you, Kate. Thank you for having me.
I appreciate your coming on because, as you said, you wear a number of hats. Professor in the College of Pharmacy at URI, but involved with Rhode Island's Antimicrobial Stewardship and Environmental Cleaning Task Force.
Yes.
Wow.
Yes.
But there's a very specific purpose to this, and that is to address antibiotic use and things that Rhode Islanders should be aware of. There's a campaign going on currently. So tell us a little bit about your involvement with it.
Happy to. So the Rhode Island Department of Health, starting in September 2018, started this large dual public health campaign, really addressing the importance of antibiotic awareness and hand hygiene. So what we did is we moved forward and focused on both the providers, caregivers, and patients in all of the high traffic volume prescribing offices throughout the state of Rhode Island. And we put together some posters that we could share, pamphlets that were bilingual, both Spanish and English, also Portuguese. We started a social media campaign. It was exciting. We were in local cinemas across about 88 different theaters, cinema pictures. We also did work on both TV and the radio, and we had about 3.7 million impressions just over those 3 months. So really impressive work by the Department of Health.
So tell us a little bit about that message getting out from everyone from the individual to the healthcare provider.
Yeah, so it's really focused around being antibiotics aware. And why this began is because antibiotic resistance is a global health crisis. It's really a national crisis. And what we find is that in America, every year, about 2 million patients develop an antibiotic resistant infection, of which around 23,000 persons die annually from these drug-resistant bacteria. So why does this happen? When antibiotics are used when they're not needed, when you have a cold or a flu and you take antibiotics for a virus, they're not going to do anything to help you out. So antibiotic resistance is developed. The antibiotic pipeline for developing new antibiotics is dwindling. We're not getting many more of those in the next 5 to 10 years. So we really need to preserve what we have. And what antibiotic resistance is, so if you get sick and you do have a bacterial infection and you need an antibiotic and you take that antibiotic, if you have a resistant bacteria, that bacteria will continue to grow while you're taking the antibiotic. Not good. You may go a couple days hoping the antibiotic will kick in. You're getting worse. You go to the hospital. They admit you. It will take the hospital, even after taking a couple samples, a day or two to figure out what is going on while you continue to get sick. So one, the antibiotic pipeline is getting sparse. We're not going to have a lot of antibiotics in the future, in addition to the fact that we're overusing them and using them when we don't need it.
When do you think that really got to that level of awareness? And as you said, it really is that level of ineffectiveness, obviously seeing it in the hospitals. But what was sort of that tipping point? I mean, both from an academic standpoint and a practical standpoint, when do you think between the healthcare arena and the public health arena that they said, wow, we've got a serious issue on our hands?
Great question. I can give you my personal experience and also what we were seeing nationally. There was a trend maybe around 15 years ago that we were getting patients very sick in the hospital, in the ICU, and we would get their culture reports back from microbiology. And we would see what the bacteria was, and it was resistant to 10, 15 different antibiotics listed. And we're standing there with our sick patient thinking, what are we going to do? This patient has a bacteria that's fully resistant to nearly every antibiotic out there to treat it. And it's important for people to understand, too, that we have antibiotic resistance out there. We've done great with medical advances in oncology, cancer, organ transplant, diabetes. And what a loss it would be is if we continue to make progress in these conditions and then have no antibiotics left to treat these patients when they really need it.
And you raised the point of, again, that resistance. And let's go back to that patient level. And as you said, waiting after you've gotten an antibiotic to see if there's an issue. So is there a time frame that a patient should be acutely aware of what may or may not be working? Is that critical for that patient to inform their healthcare provider of how they're doing? And as you said, not trying to wait it out.
Yeah, excellent question. So say you're feeling sick, you go to your provider or a walk-in, they determine that it is a bacterial infection, not from a virus, and you do need an antibiotic. After about a good 24, usually 48 hours, you should start to feel better. And if you're not feeling better by around 48 hours later, you need to call your provider back and they need to reevaluate you to see if you have a drug-resistant bacteria.
And I'm sure healthcare providers are very well versed in this, and as you said, trying to let the average individual know about this as well. If your doctor says, I'm going to put you on an antibiotic, should you really, as take that advice? Are there any questions that a patient should ask? Do I need this? Are there other things that we can do? Or is the doctor the last resort to say they know best?
Excellent question. So we are really focused on empowering the public, empowering the patient. Because when we talk to providers, they will say, we know that this is the appropriate use, but our patients are demanding it. And sometimes I'll hear the patient say, no, my provider said you have to have it. Everyone's kind of doing a little bit of this. So speaking to the public, speaking to the patients, really important for you to say, your provider, do you think this is a bacterial infection or a virus? And what if, and this is the suggestion we have, is if you got the prescription, because sometimes you don't know, if you get the prescription and you try the watch and wait approach, you go home, maybe you need to take ibuprofen or Tylenol, drink water, rest up, relax, have that prescription. If you're not feeling better the next day, maybe that's when you go and get it filled. We're calling it the watch and wait method, but talk to your provider about that. Very important.
Let's talk about the second part of the task force, environmental cleaning.
Yeah.
So a couple of things, we're talking about ingesting oral antibiotics, but everything is antibiotic this and that and this and that. Yes. So not just what is being treated internally, we're treating in the environment because everyone thinks the cleaner the better. We need to be so clean, but is that an issue as well?
Great question. So what you're speaking to is the World Health Organization One Health approach. What we do to humans and do to animals and do to the environment is all affected in the same One Health kind of approach. So that's exactly where we're focusing our efforts to. To talk about, it's really important to wash your hands. That is critically important. But there's a lot of research being done is that we have a natural protective coating of bacteria on our body and in our gut, and we want to protect that. And do we strip that down, or what do we do to maintain optimal health? Still, great question. We're still figuring that out.
So do we not know yet? Should you be using regular hand soap or should you always be going for that one and have that hand sanitizer to kill those germs?
Yeah, CDC has good recommendations on that because that's a common question. And what they recommend is when you can just wash your hands with soap and water, that's the best. If there's a norovirus outbreak, if there's C. diff, those viruses are best killed by washing your hands, not by alcohol. Purell type products. But, in between taking time to wash your hands with soap and water, which is preferred, if you need to quickly use some type of alcohol-based hand sanitizer, that will work well in between. Sometimes they say every third or fourth time.
Okay. And let's talk specifically about perhaps maybe vulnerable populations, whether that's young people or old people. Young folks in particular. There's a lot of talk that, kids might not be as exposed to germs that they need to. Everyone wants to have their child in a cocoon and make sure they're safe. Is there sometimes overkill and too safe and really too sterile of an environment?
Yes. This is an important conversation, and I can only give my personal opinion on this. If you believe in evolution, right, we evolved hundreds of thousands of years ago, right? In dirt, in caves, right? Not eating sterile food. And it's only been in the past 65, 70 years that we have taken antibiotics. So we've been harnessing these antibiotics naturally from the soil and other bacteria and taking them. So there's some conversations around that question on what do we do and what have we done to our body and our immune system. So you're getting right to the heart of it. I am with you on that, but still no conclusive data on that. Yeah, you're good.
And how about also food products, especially animal products? I don't know if that's part of the task force jurisdiction, but a lot of times, you'll see things saying, a milk produced without antibiotics or meats without antibiotics. Is that something people should be considerate of? Does that impact, again, that microbiome?
Yeah, great question too. So back in 2015, the White House really focus on antibiotic resistance. And they have gone to all of the food safety from, McDonald's to Walmart to all the groups, asking for them to go to the farmers to ask for antibiotic-free meats, milk, all of those products. So that's a huge push nationally to try and decrease the amount of antibiotics in farm animals, so we don't have that transferred to us.
So it's come through the pipeline, so to speak. Anything else while you're here that you think folks should know? Again, embarking on this big awareness campaign, as you said, millions of impressions, really letting Rhode Islanders know a very important issue about antibiotics. Anything else that we might not have hit upon?
One thing to clarify, that when we do surveys to the public, we want them to understand that they do not become resistant to the antibiotic, but the bacteria that they may acquire or the bacteria they naturally have on their body become resistant to the antibiotic. So there's a difference. You don't become resistant, the bacteria does. So I ask everyone to, talk to your provider, see if you really need an antibiotic, if it's just a cold, if it's just a sinus infection caused by a virus. Double check and see if you're doing more harm than good, taking an antibiotic that might cause diarrhea, a yeast infection, altering your gut microbiome, to see if you really need that antibiotic.
Well, again, a very important public health issue, and I appreciate having the professor from the College of Pharmacy at URI, Kerry LaPlante. Thank you so much for taking the time to come to the State House. I appreciate it. And thank you for watching here at the State House. Be sure to tune in for more Go Local Live this afternoon.